If I had not participated in the ITP SRH program, I think I would have missed a lot of knowledge with sexual reproductive health programming. I serve with youth, women and men who are actually affected by sexual reproductive health. I think I would have missed a lot of knowledge, especially from the sharing that we had as different participants from different countries about the challenges that are affecting the different categories of people in terms of a very, very fundamental component of life. Sexual reproductive health is actually a global issue that should be handled at a multi-sectoral with a multi-sectoral kind of approach. I also realized that sexual reproductive health programming is actually affected by a number of factors, including the social factors in the different countries we come from, because some of our colleagues that shared with us, if I may quote from South Sudan, there are social, cultural factors that actually affect the programming of sexual reproductive health in their country. And I was also able to relate with some of those in my own country, Uganda. There are also economic factors where I was able to understand that the economics of a country, the resources the country has, have effects on the service delivery of sexual reproductive health services. Looking at sexual reproductive health with a global perspective. When we visited Sweden, we actually had a bit of exposure to see how the health system in Sweden actually promotes sexual reproductive health in that country. And it was really very amazing to see how the government in Sweden really puts health at the forefront. When we visited one of the remotest health facilities, we found this facility fully stocked with all equipment that every person would need to access very, very standard sexual reproductive health services. There's an old lady that I visited in one of the health facilities in Sweden. She has been a midwife for 40 years. And she actually told me she has never experienced a maternal death in her 40 years of service. That really stood out for me. I was like, wow, these people are really doing this thing, so we can actually also do it. Annette Oga from Lund University, that was one of our facilitators. She was actually emphasizing the issue of peer-to-peer learning. So when we go down to these school health clubs, the peer-to-peer learning has actually helped youth so much for them to have access to information about SRH, for them to learn issues about SRH because they're actually learning from within themselves. And in a way, some of these youth that were actually left behind are actually now utilizing sexual reproductive health services at the facilities near them because now they can access information and they have actually learned from their fellow colleagues. I have actually learned a lot. I'm still learning a lot, and already the knowledge I have, we're actually putting it into practice. We're actually designing more programs for youth. We are thinking of so many innovative ways of how we can improve our sexual reproductive health service delivery in the country. And we believe with time we shall have a Uganda that will actually address most of these issues.